Hello everybody, Namaste, Sat Sri Akal. So as we all know, 4th February is the World Cancer Day, and we at Birla Hospital in New Delhi and also in Gurgaon, we are celebrating this as a World Cancer Month. And greetings from my side, I am Dr Mandeep Malhotra, Director for Surgical Oncology at Birla Hospital in New Delhi. And our message across is for all of you that don't give up. Don't give up on hope, don't give up on there is treatment, and apart from treatment, if there is hope, obviously something can eventually be done. So there's something very interesting which I experienced in last few months. I wanted to share with all of you. So we had a 41-year-old young guy. So he was the sole breadwinner of the family, and he developed a cancer in this right hand lower part of it. And maybe he had a wound or road traffic accident, the wound was not managed properly or neglected, that it finally converted into a squamous cell cancer. That is something which happens, and this is something I want to share a message that please don't take wounds like very lightly. Some burn wound, some road traffic accident wound, they all if they have not managed properly, in due course of time, like in years or long months, they might get converted into cancer. Unfortunately for this guy, this happened, and there was a tumor here. And when he came to us, he had already underwent a surgery in which they had removed the tumor, and also the lymph nodes from the armpit was removed. They had given radiation chemotherapy after that. Unfortunately, though it was a close margin, but yes, unfortunately the cancer recurred. And when he had come to us, there was a tumor here which was going right into the muscles of the hand. It had gone right up to the wrist bones or carpal bones. So when we did a PET scan, it showed that the tumor is involving the bone. That is unfortunate part, but fortunate part was that there is no spread in any other part of the body. And majority of the opinion was that to have an amputation, that is to remove the hand. So after we consulted our team, we had a lot of brainstorming. So we thought of giving him a chance, in which we resected the tumor, that is, we removed this part of the hand, in which the skin, the muscles, even this is the metacarpal bone, so below the little finger. So we removed this bone, part of this bone, part of the wrist bones were removed. But the point was that fortunately his thumb and his index finger, so the nerve supply and the tendons was saved, and this part we hope that it will move. And now, since there was a defect here, so the hand has to be reconstructed, obviously. And this was the post radiation bed, and as you can see in the picture also, so it is very difficult for us to use the latest technique of autologous tissue transfer. Autologous tissue transfer means that I can use tissue from the thigh or the hand and take blood vessels from there and put it here and anastomose with the blood vessels here. But since this is a post radiation, post surgery bed, so it was difficult for us to find these vessels to anastomose, और उनको हम join करने के लिए मेरे पास option नहीं था. So previously, when this technique was not used, we used to put tissue in another part of the tissue. Like हमने इसमें क्या किया, जो abdomen का skin था, we put the hand in the abdomen and we use the abdomen skin to cover this defect. So normally what happens is that we have to keep it for around 4 to 6 weeks, so that जो यहाँ की blood supply है वो फिर finally हाथ के दूसरे part से ले ले. और after 6 weeks we dismantle this, and now as you can see in this picture, so there is a hand is now this is a new hand with abdomen skin here, and this has now basically taken up, and now we have subjected him to physiotherapy, in which he started moving his finger, he started moving his thumb, and over the time he'll regain a lot of movement in his hand. And this is something which is really I wanted to share, that it was just not our skills, it was obviously a patient's hope and patient's faith, that there was a faith and trust that these guys would do a right thing for me, and they'll do everything possible to do the appropriate part. What I mean by appropriate part is that yes, the cancer cannot be compromised, the life is most important. So life comes beforehand. I cannot lose somebody's life if I just want to save the hand. So we tried to save the life, and there was no compromise on that. And simultaneously, whatever best possible thing which we can do, which is available at this point of the time in the country or across the world. So this is what we were able to deliver. And the best part of this institute is that we are very open to suggestions. We are open to new things. And obviously when we looked into this kind of an approach, so in our tumor board meetings, in our discussions, we used and we talked to a lot of people, just not within hospital, within country or even outside the country. And that is how we came to this plan. And with God's grace, the plan is successful. We are able to save the life, and also we are able to save the hand. So the message again is, please don't give up. Let us try and give us a chance. We might be able to help you. Thank you.